So first we're going to evaluate the cervical spine. And in order to do this, we're going to have you put your chin to your chest, chin to the ceiling, chin to your right shoulder, chin to your left shoulder, ear to your right shoulder, or left, and then ear to your right. So we're doing this evaluation in order to make sure the symmetry on both sides is equal. Now I'm going to go ahead and palpate the back of your spine, and then I'm going to push on top of your head. Do you have any pain? Okay.
No.
Next, we're going to screen for core stability. In order to do this, I'm going to have you squat down with one leg 90 degrees. Okay, and then the other leg, try to go as far down as you can. Okay, so you want to make sure to check for their balance to see if their knee rotates at all and to check their pelvis. He did lose his balance a little bit, but now to make it harder, we're going to have him stand on the pillow and try. Okay. So as you can tell, the pillow made it a lot harder and he lost balance a little bit more than without the pillow. Now we're going to go ahead and do the surface anatomy palpation. So the first thing you're going to want to do is find the sternoclavicular joint, and then find the clavicle, follow the clavicle all the way to the AC joint. And then in order to find the acromion, just pinch this together, and then here's your acromion. So after finding the acromion, you can follow the acromion all the way to where it inserts in the clavicle. Now we're going to go and find the coracoid process, and some muscular people it's harder to find, but if you squeeze hard enough, you can find the coracoid process. Okay. So then when looking at the head, you want to make sure to palpate it to make sure it's in a good position. And then this dotted line right here, this is going to be the bursa. So you can't really palpate the bursa, but the bursa is going to be on the lateral and anterior end of the acromion. So you want to make sure to check for any tenderness in the area, making sure it's not tender at all. Next, you're going to go ahead and look at the biceps tendon. In order to properly see where the biceps tendon is, you want to have the arm rested and slightly turned out. And you can feel it anteriorly, and it should feel like a ropey structure. So the rotator cuff is going to be oriented on the greater and lesser tuberosity. The subscapularis will be on the inside of the biceps tendon. And then the supraspinatus, infraspinatus, and teres minor are lined on the lateral aspect over the greater tuberosity. So the last exam we're going to look over is going to be for the shoulder and neck. So first we're going to go ahead and look if there's any swelling in the SC joint and the AC joint, the coracoid, and the biceps. Then we're going to turn them around and go ahead and observe their scapula. We want to notice if there's any tilting and then measure the difference from the thoracic spine. As you can tell, the one on the left has less of a gap between than the one on the right. Now we're going to go ahead and look at the range of motion. So go ahead and do shoulder flexion, shoulder abduction, internal rotation, and then external rotation. Now we're going to go ahead and look at the Apley scratch test. What I'm going to have you do is go into abduction, external rotation, and we're going to look at both arms. His are equal, but usually your dominant hand won't be able to go as far. Now looking at adduction, internal rotation, and here you just want to mark their range of motion, how far they can go. It seems pretty equal on both sides. Now I'm going to have you go into shoulder flexion, all right, and then go down slowly. We want to go ahead and observe the scapula. Notice the right one wing flares out a little more, and then go into shoulder abduction, okay, and down slowly. And so same thing, you notice that the right scapula goes out a little more. For strength testing, first we're going to test for deltoid C5, so don't let me push down, okay. Next we're going to test bicep strength, so go ahead and try to curl for me. That's testing C5. Triceps, go ahead and try to push down. That's testing for C7, radial deviation, so try to just push up for me. That's C6. Go ahead and extend your fingers. Don't let me push them in. That's C8 to T1. And then you can also test for pushing your wrist up. Go ahead and push up. And wrist down for strength testing. Now we're going to go ahead and test rotator cuff strength. In order to do this, I'm going to have you put your arm out, put it about 30 degrees, and go ahead and try to push up for me. That's going to be testing supraspinatus strength. Then I'm going to have you go ahead and put your arms like this, and then go ahead and try to push out for me. That's testing infraspinatus and teres minor. And then go ahead and do the same position and try to push in for me. That's testing your subscapularis strength. So first we're going to go ahead and palpate the SC joint. And then you're going to find the clavicle and palpate to the AC joint. And then when you go ahead and grab the shoulder, your thumb usually lands on the coracoid process to the greater tuberosity, lesser tuberosity. Then I'm going to have you turn around. We're going to go ahead and check if there's any trigger points on the edge of the scapula. Then we're going to go ahead and palpate the spine to see if there's any pain. During palpation, you want to notice if there's any pain, because if there's pain in specific spots, then you have a good idea of what the problem is. So for the first test, we're going to go ahead and look at impingement. So I'm going to first have you do the nearest test. You're going to go ahead and put your thumbs down and go ahead and just extend. And if there was any pain, that could indicate impingement. The next one is going to be the Hawkins impingement test. I'm going to go ahead and just try to internally rotate the shoulder to see if it reproduces any pain. Any pain?
No.
So for this one, we're going to go ahead and look at impingement of the AC joint. So I'm just going to have you move your arm over, also known as the scarf test. So if they experience any pain, that would be impingement in the AC joint. Next, we're going to go ahead and do the apprehension test. Usually when they put themselves in abduction and external rotation, they'll feel like their shoulder will give out if they've had a previous shoulder dislocation. So for the relocation test, if you just kind of stabilize the shoulder, then they won't have that pain anymore. Now we're going to go ahead and test for laxity. So first, for this one, you want to go ahead and stabilize the scapula and then find the humeral head and just move it backwards and forward to test for laxity. We're testing for posterior, anterior, and lateral laxity. If you pull the shoulder down and you see a divot, that would mean you have inferior instability. If you're unable to move in multiple directions, that would be multi-directional instability. Now we're going to go ahead and test for labral pathology. So first we're going to do the O'Brien's test. I'm going to have you forward flex your arm, abduct, and put your thumb down. Now I'll go ahead and push up for me. If they have any pain in the AC joint, then they would have AC pain. If it's a lot deeper, then it'll be positive for labral pathology. Now in the same position, but palms up, I'm going to have you go ahead and push up for me. If this pain is if it's a lot more painful, then this would be a positive O'Brien's test. If the pain was equivalent for each, it would be, it wouldn't mean that anything if the pain was the same. Now we're going to go ahead and do the crank test, and this is a labral test that is superior on the labrum. We're going to go ahead and go into 30 degrees of flexion and 90 degrees of elbow and shoulder. So we're going to go ahead and push into the shoulder joint while internally and externally rotating. We want to look for any clicking or popping. Next, we're going to go ahead and do the clunk test. In this one, we're going to go ahead and have your shoulder here, and we're going to go ahead and push in and internally and externally rotate. This is going to test for a posterior labral tear. So now for the biceps test, we're going to go ahead and do the speeds test. I'm going to have your arm flexed 30 degrees, and then go ahead and abduct at 60 degrees. Have your palm up and go ahead and push up for me to see if there's any pain in the biceps. Then for the Jurgensen's test for bicep groove pain, I'm going to have you in a 90-90 position, and then go ahead and try to supinate your wrist for me, so push it out. Try to push it out while I hold it, okay? And then you want to feel the biceps groove when it's with resistance to see if there's pain. So now you want to go ahead and make sure that there's no shoulder pain that's radiating down the neck. We want to go ahead and do a Sperling's test. So I'm going to have you put your neck forward and back. Go ahead and rotate your neck to the right and extend it. I'm gonna go ahead and push on the neck to see if there's any pain, and then do it to the other side. And did you experience any pain?
No.
So that concludes my video. Thank you for watching.